Well, the theme of today's conference is working together to deliver the workforce of the future. There's no doubt that it's an exciting but challenging time across health and social care currently, and I think workforce planning will be right at the heart of that.
There's a lot of expertise here, a lot of people who've been working in this area for a while, so they can come together, hear what the centre's been doing to support them, but also share best practice and some of the lessons and some of the ways forward to address those challenges.
If you look at who we've got here today, we cover the whole breadth of health, public health and social care, HEE, providers and commissioners, as well as GPs on the ground.
The NHS is about people, and if we don't get the workforce right, we don't get the NHS right, and indeed broader than the NHS, public health and social care as well. 70% of what we spend in the NHS is spent on paying people's salaries. Yes, equipment is important, yes, buildings is important, but if we don't get the people with the right skills, the right values, the right behaviours, but also available in the right place at the right time, then we will fail.
So the workforce challenges that I think we've got at the moment are about getting the right people, ensuring that they've got the skills and the competencies to do the job, but that they're also caring and compassionate in the way that they do that. And I think that the Care Quality Commission can really help in the way that we regulate and inspect those services.
Now, workforce forecasting is notoriously difficult in the National Health Service in particular, so it's not easy, and people have to have a good, high quality source of workforce intelligence in which they can have confidence. CfWI is just that organisation in my view.
What we're really keen to do, and I think we're seeing that, is to see colleagues gaining a greater understanding of what CfWI does and to be able to take that back, hopefully, in practical terms to their organisations.
I think it's the expertise that we find within the CfWI that gives us the real benefit. Obviously we take responsibility overall for workforce planning, but some of the analytical skills, some of the opportunity to look at global trends, global patterns, and indeed to look at some of the economic indicators that we need to factor into our health and public health workforce numbers is critically important to us.
Well, I've done a review recently of the Centre for Workforce Intelligence, and I've had the privilege of talking to many people about their views of future workforce needs, and it's very clear that making sure we've got a workforce that is the right number of people with the right skills, sufficiently flexible to meet future demands, is all important.
I think there are three key challenges that we need to make sure that we're embracing in terms of looking at the future workforce. That's around the economic environment, that's around the transformation of healthcare services, and that's how technology changes the way we all work and interact with patients and the public.
So I've really enjoyed today. It's been really interesting to think about how the Faculty of Public Health and public health in general as a specialty could be involved in being part of the solution to some of the challenges faced in workforce planning.
It's been really good to hear the presentations this morning talking about integrated, joined up health and social care.
The most valuable aspect of today's event is getting people from different sectors together, the collaboration, the cooperation that we hope will emerge.